Okay, so BSI is my scene safe. Yes, like my scene is going to be safe. So first, what I'm going to do is like, of course, like the mechanism of injury. The MOI is going to be motor vehicle ejection, and then next is going to be my number of patients. So of course, this is going to be like my only patient. Next is going to be call for additional ALS assistance. So I'm going to go ahead and I'm going to do that. And then, of course, I'm going to consider C-spine and direct my partner to maintain and stabilize like the head for me. Because since my patient is unconscious and she was ejected from motor vehicle, we have to maintain and stabilize the head. And then my general impression would be a 24-year-old female that was ejected from a motor vehicle. And then right now I'm going to determine my patient's level of consciousness using AVPU, which is alert, verbal, painful, and also unresponsive. So, ma'am, are you okay? Hello, can you hear me? Hello, hello. Okay, so my patient responds to painful stimuli with a sternum rub. Next, I'm gonna go ahead and do assess like the ABCs. So I'm gonna go ahead and check her airway. Since it is a trauma patient, she's unconscious, I'm gonna use a jaw thrust. So when I open up the airway, of course, jaw thrust, her airway is clear and patent. I'm able to hear her breathe. And next, I'm going to like assess breathing. And when I do that, when I auscultate and listen, her breathing is going to be 30 breaths per minute, and while I'm auscultating on each side. My patient has pain upon palpation on her left side, and then I'm gonna go ahead and apply high flow oxygen 15 liters per minute via non-rebreather. And then next, I'm gonna go ahead and check for her circulation. I'm gonna go ahead and check for her radial pulses, and they're both present. They're weak, and I have a pulse of 130. And next is going to be her skin. So I'm gonna assess her skins. I'm gonna assess the color, the temperature, and also like the condition. So what I see and what I get is going to be the cool, clammy, and also diaphoretic. And with all these signs is also shock, is the signs of shock. So of course, if my patient does go into shock, I'm going to treat for that, and then also treat any major bleeding that I see. And the major bleeding, what I would be seeing would be her small like little laceration that's on her on her right lower extremity of her leg, but it's minimal bleeding. So I'll just go ahead and take a note of that and just assess everything else prior to that. And then next, we would let them go as soon as possible. And I will not be able to take a sample history because my patient is unconscious. So we'll just go ahead, forget about that. And then we'll go on to our secondary assessment. And I'm going to be using DCAT BTLS, which is checking for deformities, contusions, abrasions, penetrations, lacerations, any tenderness, and also any swelling from like the head to toe and also the back. So when I go and I inspect and palpate her head, I won't be able to feel like any crepitus. I'm gonna be checking her eyes for running like raccoon eyes, which is like bruising around like the eyes. I'm gonna be checking her pupils to making sure that they're equally reacting to light and that they're not unequal. And then next, I'm gonna be going to her ears to check to see if any CSF fluid is coming out of there. Then next, I'm going to inspect and also palpate her neck, checking for any tracheal deviation, any JVD, which is jugular vein distension, or also like on the back of the neck for any step off. And then I'll be going down to her chest. I'm going to be inspecting, palpating, also auscultating. So upon inspection, or when I palpate on the sides, I'll of course I have that she has like pain on her left side, and also like when I'm auscultating, there's still um 30 30 beats per minute in like the respirations, or 30 breaths per minute for respirations. And then I'm going to be going down to her abdomen. I'm going to be inspecting and palpating that. And while I'm palpating, I'm going to be filling her abdomen in a rolling motion on each quadrant, all 4 quadrants. So like while I'm doing that, the abdomen is going to be soft. The next would be like the pelvic region. I'm going to be checking and making sure that it's stabilized. I'm going to be cracking it like a book. So I'll be applying pressure, like pulling up and also pushing down to make sure that it's stabilized. And yes, it is stabilized. And then I'm going to be going down onto her lower extremities using offset pressure. So I'm going to do an offset pressure on her right leg. And then, of course, since there is like a laceration and bleeding on this right leg, there is pain to it. So go ahead and note that, of course. And then I'm gonna also check her other leg too using offset pressure. There's nothing there, and also assessing pedal pulses. Pedal pulses are present. And then I would also check for CMS, but of course my patient is unconscious, so I won't be able to do that, but pedal pulses are still present. Next, I will be going, we're checking for like the radial pulse, and my radial pulse is still present. And then we'll already be like in the back of the ambulance, but prior to that, I'm gonna be splinting her leg, her injured leg, and then also inspecting and palpating her her back region to making sure that there's like no snip off, or making sure that there's no injuries before putting her on like the longboard. And then of course um, do or manage any secondary injuries that I see. And then I'm also take a base set of vitals, and her blood pressure would be 92/68, pulse would be 108, and then her respirations would be 102, which is good. The oxygen is helping her. And then since this is a critical patient, I'm going to be reassessing my patient every 5 minutes until like we get to the hospital. And that is it for trauma assessment.